Hello and welcome. Today we're diving into a silent threat to your vision: ocular hypertension. Many people don't even know they have it, but understanding this condition is vital for preserving your sight. Let's explore what it is, what causes it, and what you can do about it. So, what exactly causes this increased pressure in the eye? While the exact cause can be complex and vary from person to person, several factors are known to contribute. One common culprit is an imbalance in the production and drainage of aqueous humor, the clear fluid that nourishes the eye. If more fluid is produced than drained, pressure builds up. Certain medications, like steroids, can also increase eye pressure. Eye injuries, underlying medical conditions, and even genetics can play a role as well. Sometimes no specific cause can be identified, which is called primary ocular hypertension. To understand ocular hypertension, we need to look at the inner workings of the eye. Aqueous humor is constantly being produced and drained through a structure called the trabecular meshwork. In ocular hypertension, this drainage system becomes less efficient, or more aqueous humor is produced, leading to a build-up of pressure inside the eye. This elevated pressure puts stress on the optic nerve, the crucial cable connecting your eye to your brain. While ocular hypertension doesn't always cause damage, it does significantly increase the risk of developing glaucoma, a condition that does damage the optic nerve and can lead to irreversible vision loss. Ocular hypertension is more common than you might think. It affects millions of people worldwide, particularly as they age. While it can occur at any age, it's more prevalent in individuals over 40. Certain ethnic groups, particularly African Americans, have a higher risk of developing both ocular hypertension and glaucoma. Family history also plays a significant role. If you have a family member with glaucoma or ocular hypertension, your risk is increased. Ocular hypertension is often called a silent thief of sight, because, in most cases, it has no noticeable symptoms. People with ocular hypertension typically have normal vision and no pain or discomfort. This is why regular eye exams are so crucial. Without them, the condition can go undetected for years, increasing the risk of developing glaucoma. Diagnosing ocular hypertension relies on a comprehensive eye exam. Your eye doctor will measure your intraocular pressure, or IOP, using a technique called tonometry. A reading above the normal range of 10 to 21 mmHg suggests ocular hypertension. However, a single high reading isn't enough for a diagnosis. Your doctor will also examine the optic nerve for any signs of damage, assess your visual field, and measure the thickness of your cornea. These tests help determine your risk of developing glaucoma and guide treatment decisions. Ocular hypertension isn't typically classified into distinct types in the same way as glaucoma. However, it's important to distinguish between primary and secondary causes. Primary ocular hypertension, as mentioned earlier, has no identifiable underlying cause. Secondary ocular hypertension is caused by other factors, such as medications, eye injuries, or other medical conditions. Identifying the underlying cause of secondary ocular hypertension is important for effective management. The primary goal of treating ocular hypertension is to lower the intraocular pressure and prevent the development of glaucoma. Treatment options typically involve eye drops that either reduce the production of aqueous humor or increase its drainage. These medications need to be used regularly as prescribed. In some cases, laser therapy may be considered to improve the drainage of fluid from the eye. The specific treatment approach depends on the individual's risk factors and the severity of their ocular hypertension. Regular monitoring is essential to ensure that the treatment is effective and to adjust it as needed. Unfortunately, there is no guaranteed way to prevent ocular hypertension. However, you can take steps to reduce your risk. Regular, comprehensive eye exams are the most important thing you can do. These exams allow your eye doctor to detect ocular hypertension early, before it causes any damage. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also contribute to overall eye health. If you have a family history of glaucoma or ocular hypertension, it's even more important to be proactive about your eye care. The prognosis for individuals with ocular hypertension varies. Some people with ocular hypertension never develop glaucoma, while others do. The risk of developing glaucoma depends on several factors, including the level of intraocular pressure, the thickness of the cornea, and the presence of optic nerve abnormalities. Early detection and management are key to preventing vision loss. Research continues to explore new and innovative ways to treat and prevent glaucoma in individuals with ocular hypertension, including new drug delivery systems and more targeted therapies.